So here's what we're going to do with the personal injury documentation. We're going to go through about 30 different diagnostic categories. We're going to walk through them. And we're going to evaluate them, what should and shouldn't be done, relative to the low impact soft tissue spinal injury. Remember, that's the focus. When we narrow it to that, we can narrow down a lot of things. If we don't have any, if we're not going to pick a particular condition, then it would just take forever to cover everything. But when we go to the low impact soft tissue spinal injury and go, okay, let's pay attention to the documentation for that case, makes things a lot easier. And then once you know the basics of that, it makes it way easier if there's a disc involved, nerve involved, concussion, anything else. Because that's the core. That's the foundational principles of personal injury documentation. So we're going to go through about 30 different diagnostic categories for the soft tissue, one at a time. We're going to take a look at the narrative report topics, the primary goal relative to activities of daily living. We're going to pay attention to understanding the science of the three phases of healing. You have to know the basics of the science of the three phases of healing if you're going to do personal injury. You have to be able to explain it. You have to be able to explain why somebody has pain when they move just a little bit, or no pain when they move just a little bit, but they have more pain when they move a little more, and it's only in one direction. They don't have pain when they go in this direction now. You have to be able to explain that. That's the science of the three phases of healing. You've got to be able to explain your therapeutics based on the patient's biomarkers. Why did you do the therapy you did? Relative to their test and the three phases of healing. You've got to be familiar with phases of spinal degeneration and how it leads to the #1 disability in the United States, osteoarthritis. 3 sources of pain-based science. We've got to go into what are the sources of pain based on the science of the three phases of healing. That's what we got to go into. There's 3, you could say 4 major sources of pain. We've got to know what that is. We got to be able to explain it in a narrative report or to a jury. We've got to know why, and we have to be able to explain to a jury why the patient has restrictions. Why do they not have any restrictions when they just move a little bit? They only have restrictions maybe at the end of one plane of motion, and it's at the end, and all the other planes of motion are totally normal. Can you explain that physiologically? Well, that's the science of the three phases of healing. Source of re-injury with ADLs. I have to explain why the patient's more susceptible to re-injury or why they did have a re-injury. How to determine the prognosis and need for future care. And again, a key component with personal injury is that we want to do everything what's called third party and objective trusted. Remember, the more you use your opinion, the more you're going to be attacked. So everything we want to do is what's called third party objective findings. We don't want to use our opinion at all. So as we go through all these categories, we're going to use third party trusted sources. That cannot be attacked. As an example, I just gave a testimony recently. Went through everything that I just talked about. I testified in trial, went through the 12 steps, put it all together, explained it all, went through, and when I was done, and the jury was just on the edge of their seats. They really liked understanding the three phases of healing and how it relates to healing and therapies and all. They know, because nobody ever hears that before. So I finish. The defense attorney, the insurance attorney, did not challenge me on one clinical piece of data. Not one. He couldn't. That's how tight it was. Source of restricted ADL movements. We got to go into that. That's real important that we understand how to document ADLs, range of motion with the ADLs, and explain that. We talked about source of re-injury, how to determine the prognosis. And then the last one is how to apportion the pre-existing injury. Well, we need to know how to do that because that's Remember, that's one of the most common defensive arguments to decrease their insurance is pre-existing injury, okay? So that's the big picture. That's what we're going to be going into in detail, each one of these categories, and be walking through, all right?